you've heard my professional bio, but just a personal bio. I currently live in Mount Barker, and I was bred and born in the Adelaide Hills. I'm living at home with my husband and my adult daughter and 4 dogs. My son and his fiancée live in Bridgewater, nearby Bridgewater, and I'm lucky enough to still have my mum with me, and she lives in Stirling. Okay. So collaborators for this particular presentation, I didn't do it all myself, are wonderful. Within Kidney Health Australia, we have a wonderful primary care education team, and they have a peak body called the Primary Care Education Advisory Committee. So that committee actually gets consumers involved in the production of some of our education material. So I'm hoping that today you will be able to understand the link between kidney disease, diabetes and cardiovascular disease. I'd also like to explore some of the pathways for end stage, in the hope that that puts the wind of God up you and you look after your kidneys. Also understand the progression of kidney disease and key detection and management goals, and the impact that these can have on your outcomes, and be aware of the resources that we have at Kidney Health Australia. And just to give you a bit of a snapshot, kidney disease is also very common. 1 in 10 adults have at least one clinical sign of chronic kidney disease. It's in the top 10 categories for causes of death, and it kills more people than breast cancer, prostate cancer and road deaths put together. The good news is it's manageable if it's detected early and treated properly, and we can significantly reduce the progression of kidney disease. And just in another way of putting that, really, it's less than 10% of people with chronic kidney disease are aware that they have any of the signs or have the condition, and it is possible to lose 90% of your function before you will get any symptoms. So there's signs, early warning signs, but often the symptoms don't start to come up until quite late, and unfortunately at that point there is no turning back, and you're looking at renal replacement therapy, so or end-stage kidney disease, and it's not the nicest lifestyle. It is frequently coexists with diabetes and cardiovascular disease. It's a bit of a chicken and egg debate. Sometimes kidney disease can cause cardiovascular disease, sometimes cardiovascular disease can cause kidney disease, and of course diabetes can cause cardiovascular disease, which can cause kidney disease, and the cycle goes on. So what do your kidneys do? They are the most amazing organs, your kidneys. I think they're more intelligent than the brain, really. So healthy kidneys act as a filter, and they make sure that you have the right amount of waste products and fluids in your body. So they get rid of the waste products, and they make sure you have the right amount of electrolytes and fluids in your body. So every hour, your blood supply circulates through your kidneys about 12 times, okay? And each day, the kidneys process around 200 litres of blood, and yet we only urinate about 2 litres. So they're working non-stop to make sure that they don't let out the good stuff and just get rid of the bad stuff. Our kidneys make 3 important hormones: erythropoietin, renin, and active vitamin D. So it's a bit of debate as to whether vitamin D is a vitamin or a hormone. Erythropoietin stimulates the production of red blood cells, and so therefore we have plenty of haemoglobin to carry oxygen to our cells. Renin is involved in the control of blood pressure, And then the active vitamin D helps us control calcium and phosphate balance and helps us uptake calcium from our diet, and of course helps us make healthy bones. So the major role of the kidney is to, as I said, is to remove waste product from the blood and eliminate it through urine. We have about 1 million hairpin-like glomeruli at birth, and I'll show you one glomerulus or nephron later. But we lose about 100,000 of these every decade of life. Okay, so droplets of filtered blood pass through a number of tubules or tiny tubes into the medulla, a central collection region in the kidney. The glomeruli and the tubules together make up nephrons, long and extremely fine tubes, which, if connected, would run for 80 kilometres. So quite a lot. So obviously they clean the blood and return the blood by the renal vein, and waste and excess water are removed by the kidneys and pass as the filtrate passes through the tubule, and then it goes down the ureters to the bladder where it is stored as wee, and when the bladder is full, obviously it passes out through the urethra as we wee. So as I said, inside the kidneys there are about 1 million tiny nephrons, and these nephrons are our filter, and kidney disease causes the nephrons to stop filtering properly and leads to a loss in kidney function. And I just, so the plumbing is the urethras, your bladder, and then your ureters, your bladder, and then the urethra. So this is a nephron, which is made up of the glomerulus, which is the network of blood vessels that come into the kidney, and then this is the tubule, and then this is the collecting duct where the urine comes out. Okay. Renin, which I mentioned, is one of the hormones that helps control blood pressure. It's produced in about here, in the cells in there. So to remove the waste and extra water, the blood enters the kidney through the renal artery. The blood is then cleaned in the kidney as it passes through the tiny filters called the nephrons. The nephrons are the basic working unit of the kidneys, controlling the formation of urine. One kidney contains about 1 million nephrons, and each nephron contains a filtering apparatus called the glomerulus. So nephrons control fluid balance, electrolyte balance, blood pressure control with the renin, and waste removal. And how that all works in there is fascinating. It's amazing. So the signs and symptoms of kidney disease. So some of the signs are that you've got high blood pressure. Most people in this room would have no idea what their blood pressure is right now. I know I don't. So unless we go to the doctor and have it measured, we don't know. We might pick up on the changes in the number of times we wee, or notice that we wee a lot overnight, but you might just put that down to the fact that you had a lot to drink that day. Hopefully, if there is a change in your urine, you do notice the appearance of your urine, you do notice that, but most of the time people don't notice that until there's actually blood in the urine. And blood in the urine can come from all sorts of things. If we're getting down to puffiness in the legs and ankles and pain in the kidney area, there's probably something acute at least going on, and that might be something acute on top of a chronic disease. And then these other symptoms that are on this side, are generally all associated with those people who don't know they've got kidney disease until they've lost that 90% function. So tiredness, loss of appetite, difficulty sleeping, headaches, lack of concentration, itchiness, shortness of breath, nausea and vomiting, and a bad breath or a metallic taste in the mouth. And the other one is excessive crankiness. Sometimes, again, hard to actually pick. Okay, so diabetes is the leading cause of kidney failure in Australia, and unfortunately diabetes with cardiovascular disease makes up pretty much half of the pie, as you can see here, and this is based on ANZ data and data collected by an organisation called ANZ data, which looks at all renal patient data at the end of every year, so it's very reliable. And glomerulonephritis is a lot of other disease processes put together, just because the word nephritis just means inflammation of the kidney, and glomerular where it is in the kidney. So what is chronic kidney disease? So chronic kidney disease is defined as a glomerular filtration rate. I am going to call it GFR from here on in, because getting your tongue around glomerular filtration rate when you're already nervous isn't easy. So that needs to be below 60, or there are other signs of kidney damage such as albuminuria or protein in your urine. So albumin's a smaller protein, but it's still a protein, and we can pick that up in a urine test. Often we can pick that up before the GFR has changed. Hematuria or blood in the urine, but we have to exclude things like a bladder infection or prostate problems for the men, or making sure that you women aren't menstruating. So we have to just make sure that there's not another reason for the blood in the urine. So some pathological abnormalities, so an ultrasound might pick up that there are lumps and bumps on the kidneys, otherwise known as cysts. That's anatomical abnormalities, and pathological abnormalities are picked up with a kidney biopsy. So a fine needle is inserted into the kidney, and they take a few cells out and they look at those under the microscope. So what is estimated glomerular filtration rate, or eGFR? So the eGFR, or estimated GFR, means how well your kidney filters the waste from the blood. So that's actually looking at a waste product called creatinine and how well that is clearing out of the blood. Controlling diabetes and high blood pressure can help slow and prevent further kidney damage, as well as reduce the risk of heart attacks and strokes. Okay. And staying well hydrated also has a good influence on the eGFR. So how do we check the kidneys' health? A blood test, which is where we pick up that eGFR. A urine test, which is where we pick up albumin, and obviously a blood pressure test. Okay, a kidney health test, a health check needs to incorporate all three, because, as I said earlier, we'll pick up the kidney damage will first show up as protein leaking into the urine, often before we get a change in the waste product or the eGFR in the blood test. And sometimes we'll get a change in blood pressure before you see a change in the blood test as well. So CKD, or chronic kidney disease, as with heart disease and many other chronic conditions, is a major public health problem. 1 in 10 Australian adults have some sort of have the early stages of CKD. Less than 10% of people with CKD are aware that they have the condition, and as I said earlier, you can lose around 90%. It's common, harmful, and treatable, I think, is the main thing here. So where Kidney Health Australia is trying to aim its campaigning at the moment is at these 5 million people that are at risk. And if you've got hypertension or diabetes, you've already got one of the risk factors. Okay, and as you can see, right at the top, there's only 23,000 people who are transplanted or on one of the renal replacement therapies, which I'll go into later. So, are you at risk? Answer is yes, obviously for all those in this room. So diabetes is a major risk factor. High blood pressure is a major risk factor. Again, those lovely lifestyle things that we talk about, weight and smoking also are a risk factor for chronic kidney disease. Some of the things that we don't have a lot of choice about, all those non-modifiable risk factors, are our age, family history of kidney disease, if you've had had some sort of cardiovascular problem, heart disease or stroke. Unfortunately, our Aboriginal and Torres Strait Islander brothers and sisters are more likely to get chronic kidney disease than our general Australian population, and if you've had a previous acute kidney injury. So what else does Kidney Health Australia do? So we have a number of community support programs. As I mentioned earlier, this slide was put together by our fantastic primary education and care team, and they produce a number of fantastic resources. We're just in the process now of updating the chronic disease management in general practice handbook. It was delayed because of the release of the information from the Credence trial, looking at one of the oral hypoglycemics, canagliflozin, and it showed significantly positive results for slowing down the progression of diabetic kidney disease. So hopefully it'll be out in September. There's me, that's me, the helpline. We lobby government for change in policy and budget, obviously, and it's thanks to Kidney Health Australia that we now have an estimated glomerular filtration rate, or eGFR, reading on your blood tests. That's been in for around 8 to 10 years, and that's been thanks to the work of our primary healthcare team. We have a couple of mobile dialysis units, the big red kidney buses. There's a housing program in WA, SA and Victoria that allows people that live more than 100 kilometres from their renal service to have free housing while they have their transplant. I've got our annual report out there if people want to know more about what Kidney Health Australia does. Our vision is simply to improve the lives of Australians affected by kidney disease, and our mission is to promote good kidney health through education, advocacy, research and support. Kidney Health Australia has been around for over 50 years. It celebrated 50 years last year. We're headed by a fantastic nephrologist, Shilpa Jayasudasan, and a number of medical people sit on our board. So community awareness, some of the things that we do around community awareness are things like this. This year we held our Kidney Health Week in April to coincide with the International Society of Nephrology's World Nephrology Congress that was held in Melbourne. So next year we'll hold it to coincide with World Kidney Day, and that's in March. And there's our fantastic mascot, Billy the Kid. And we just like to get out there and do what we can to encourage people to think about their kidneys. So as I mentioned, community support we have support groups, just a coffee and chat. As a nurse working in the field, I've talked to many kidney patients and told them about this or that or something or other else. But the best people to teach other dialysis patients or other kidney patients is the other kidney patients. Like, I can say something 20 times, a bit like your kids, really, isn't it? When they go out, you know, you can tell them a million times and they hear the same thing from someone else and all of a sudden it makes sense to them. It's a very similar thing, you know. If a fellow kidney patient has a suggestion on how to worry about fluid control or how to remember to take your tablets or something, often the tricks and tips that they learn themselves and share amongst themselves is the best way to go. As I mentioned, the big red kidney bus, which is a mobile dialysis unit that goes to holiday destinations throughout South Australia, throughout Victoria and New South Wales. And it allows people to get away because of the high incidence of end-stage kidney disease. There is limited ability to travel if you're on haemodialysis because it can be very hard to get into other units. The capacity is just bursting at the seams. Transplant houses, as I said, this year, again, we had about 100 kids on a kidney kids camp. So that's a huge logistical undertaking because we have medical and nursing staff so that kids that are on dialysis can come along and have their treatment while they're away, give mum and dad a break. And the good news from this year's kidney camp is that one young lad, Charlie, who was on dialysis, got home on the Saturday night and got called up for transplant on Sunday, and he's doing really well. So that was fantastic news out of our kidney kids camp this year. I'll give a plug to our primary care team again. So they do a lot of face-to-face workshops and internet workshops and the like for GPs, helping them understand the contents of our GP handbook, helping them, helping bring kidney disease and screening for kidney disease to the fore. They create the resources, as I said. There's some fantastic Indigenous resources as well that Aboriginal health facilities can use to help educate their clients. We have lots of posters and all sorts, and we've got always updating our clinical action plan based on what's current, and then we've got quality improvement projects. Our biggest one two biggest ones at the moment is expanding our youth and children's programs and our Indigenous programs as well. Free service. So our kidney helpline or information service is available from Monday to Friday, 8 till 5, and we provide free information through that. You have a chat to me or one of the helpline staff, and we work out exactly what sort of information would suit you best or refer you on to appropriate people. So this is one of the resources we have for consumers. My Kidneys, My Health booklet, which is just a fantastic summary of what kidney disease is, how we manage it, how we try and prevent it, and all of those sorts of things. And then it's also available in a phone app, which is also a fantastic thing, and you can just go straight to the bit of information you want. You don't have to flick through the whole book to try and work it out. Again, if you ring and speak to me or one of the helpline team, we're more than happy to send you out the My Kidneys, My Health booklet free of charge. We're also involved in a lot of research. We've given money to Melissa Little and her stem cell research, which is Kidney in a Dish. We collaborate with diabetes bodies to look at how we can improve things for diabetes, for people with diabetes as well. We have the Australasian Kidney Network clinical trials, so they look at all sorts of quite mundane things, but that make a huge difference to the lives of people with kidney disease. And again, Anne's data, so that's the Australian New Zealand Dialysis and Transplant Association registry. So every year we collect, support them to collect information about all the known renal patients in Australia. Advocacy, as I said, we're always pushing to get kidney disease better recognised, and trying to advocate for people. At the moment, one of the biggest problems for dialysis patients is the cost of transport to and from dialysis. Some people are spending $25,000 a year just to stay alive. That's just to get to and from dialysis. And that's a huge burden, and there's no assistance for that whatsoever. We've got a big project happening at the moment, linking in with as many Aboriginal communities as we can to inform what will become guidelines for Aboriginal health and kidney disease. As you can see there, 1 in 4 Aboriginal or Torres Strait Islanders will get CKD as opposed to 1 in 10 of the general population. And the other big thing, you might have heard it in the news last year, Medicare will now cover the cost of dialysis in remote areas. It didn't used to, so the organisation, the Purple House, was covering the cost of dialysis for people on country through, they were covering the cost through fundraising and through their own financial systems. They weren't getting any Medicare funding whatsoever, so that was a huge breakthrough. So the significance of CKD staging using the EGFR, the main thing is that we can detect it early, so therefore reduce the risk of cardiovascular disease, prevent any further complications, slow the progression, and maintain people's lifestyle as best as possible. And for diabetics, probably the biggest breakthrough this year was the Credence trial, which is an oral hypoglycemic, but they looked at it specifically in relation to slowing the progression of diabetic kidney disease, and the results were outstanding, and they actually had to close the trial early because ethically they couldn't continue to not have the people who were in the placebo group, they couldn't ethically continue to not let them have access to the benefit of canagliflozin, or Invokana it's known as. So, of course, early detection means that we can slow progression, we can monitor the kidney function, we can prevent complications and reduce morbidity and hopefully also mortality. So this is our wonderful clinical director, Shilpa, and her most famous quote, I think, is that we need to move away from seeing diseases in isolation. Instead, they are a package. And when we think of one, we should always consider the others. And by those three diseases, I mean chronic kidney disease, cardiovascular disease, and diabetes. So looking at them as a cluster. So these diseases account for 2/3 of all deaths in Australia. We lose about 65 people a day to chronic kidney disease in Australia. Okay, so linking the two, cardiovascular disease, as our previous speaker said, is anything to do with the heart, blood vessels. High blood pressure is an issue in cardiovascular disease, and in diabetes, obviously the body can't manage the glucose, and you know the two different types of diabetes. And the target for your blood pressure is 130 on 80, whether that's through lifestyle and medications or just lifestyle. But that's our target. That's been shown to reduce the pressure on the kidneys and improve or slow down the progression of chronic kidney disease. So how is heart and kidney health linked? So blood pressure and the health of your blood vessels is affected by salt, water, and cholesterol. If you have an unhealthy blood vessel system, your blood pressure will go up. That will put pressure on your kidneys. High blood pressure causes damage to blood vessels in your heart and your kidneys, and damaged kidneys also may cause blood pressure to go up even further, and the cycle goes on. Some of the treatments for stage 5 or end-stage kidney disease, and we call these renal replacement therapies. It's just two, broken into two groups: hemodialysis and peritoneal dialysis. In hemodialysis, you have a vascular access formed, you have needles put into that access, and you do that for roughly 4 or 5 hours, 3 times a week. You can do that at home. You can learn to use the machine at home, put your own needles in, or you can do that in a centre. It'll keep you alive, but it's not considered by those on it the most flexible of lifestyles. It is quite restrictive. At this stage, there are significant fluid and dietary restrictions, but you get great dialysis nurses like me. Peritoneal dialysis, again, is split into two. That's a tube in your tummy into your peritoneum, and you drain fluid in and out of your peritoneum, and the peritoneal membrane does the filtering for you, and you can either do that manually through the day, and that's continuous ambulatory peritoneal dialysis, or you can have a machine do the cycling for you overnight, and that's automated peritoneal dialysis. The gold standard of renal replacement therapies is, of course, transplant. And South Australia still has the highest rate of transplant per head of population, kicking goals here. So transplant is where either a live or deceased donor kidney is removed from said donor and transplanted into the recipient, and it's plumbed in down in your pelvis there, mainly because there's just not enough plumbing left once you retrieve the kidney from the donor to allow you to have that length of ureter. So the deceased donors are people who have donated their organs after death. There's been some debate over the opt-in, opt-out process. We prefer the efforts to go into counselling people at that point. There's talk about the Spanish model. The Spanish model is actually centred around not whether people opt in or opt out, but it is around supporting a family whose loved one has died in tragic circumstances and helping them come to terms with that situation and then talking to them about that process of donation. And that's one of the reasons South Australia has such a high donation rate, is because we have transplant coordinators in all major intensive care units whose job it is to counsel people through that, and they do an amazing job. Last option is no treatment and go through supportive care. And interestingly, particularly for people in their later years, they sometimes get longer than they would if they'd been on dialysis, and they get a better quality of life. Kidney Health Australia has some really good resources to help people weigh up what's best for them. A book called My Kidneys, My Choice. And certainly the supported or palliative care option is being taken up more and more, and it's being discussed more and more. So who should I see to keep my kidneys healthy? So people with chronic kidney disease are 20 times more likely to die from a heart attack. That's a bit awful. Stroke or again, receive dialysis, but you can slow the progression of your kidney damage and reduce the need for dialysis by 50%. A chronic disease management plan with your GP is a really good way to go. You can control what resources you want, so and your GP and your specialists all have a copy of that plan, so you as the consumer are driving that. So for some of you it might be you want to keep a good track of your kidney health, you want some help with your diet, or you need some help with your exercise, or all of, so a chronic disease management plan allows you to access some of those allied health professionals that you ordinarily would have to pay lots of dollars to go and see. A chronic disease management plan allows you to access Medicare funding to help you cover the cost of some of those. So monitoring your blood pressure, keeping control of your diabetes, eating a healthy, balanced diet, which is obviously going to help with your diabetes as well, and exercise, and keeping a healthy body weight. Staying hydrated, so choose water instead. That's a frightening statistic, isn't it? I'm sure you're all aware of that, how much sugar is in Coke. Obviously, no added salt, because salt does have an effect on blood pressure, which does indeed have an effect on your kidneys and your heart. Know your risk factors. So excess blood glucose will cause damage to the kidneys as well as the high blood pressure. So about half of you in this room will develop CKD, lucky you. Diabetic kidney disease is a long-term complication of diabetes, and early stages of diabetic kidney disease will present with microalbuminuria, so small amounts of protein in the urine, often before you'll get a change in your GFR or your blood pressure. Am I going okay? Okay, so things to remember. You can lose 90% of your kidney function without feeling sick. Early detection of kidney disease greatly improves outcomes. If you are at risk, ask your doctor for a kidney health check. And as I said, take responsibility for your own health. We have a number of fact sheets available. If you would like a list of those, I'll be in the foyer during morning tea time. and happy to give you a list of those, or you can give me a call on that 1800 number to discuss any fact sheets that you might like further access to.
Okay.